Okay. Aha! Look at that. It even worked. Welcome. You are once again with us for the Chat with the Docs show from the Siloam Center for Traditional and Integrative Medicine. We have made it through another week with no cease and desist letters from anyone.
Check it off.
Welcome. I'm Mo Wolf, the acupuncturist of the Siloam Center, and
I'm Dr. Noel. I'm the chiropractor here at the Siloam Center.
And today we're going to be talking about Lyme disease. Now, often it's just
it is Taco Tuesday.
Is it?
Well, it's Tuesday, right?
Oh, it is.
Yeah, it is Tuesday.
It is. It is Tuesday. We're doing a chat with the docs. See how into it we are today. Lyme is a much bigger problem than is being reported. Let me ask you, Doc, who is the infallible dispenser of all things medical information in this society?
On Lyme disease?
Just on diseases in general.
World Health Organization?
Okay. World Health Organization or CDC.
Yeah.
Those guys, right? Well, the CDC has some real problems with their Lyme data. Okay. Just case in point, CDC reports, and I'm quoting from LymeDisease.org, CDC reports that rashes occur in 60 to 80% of cases. However, the true incidence of rash is unknown because no definitive studies on humans have been done. Okay, so these guys, LymeDisease.org, went out and they did a survey of 3,000 patients with chronic Lyme. 40% reported the rash. That's about half of what the CDC is saying. It's flipped. And there's another study that says that the distinctive rash, that fancy dancy bullseye rash, people pay good money for tattoos. They could just go out and smooch a tick. Don't do that. Don't. Another guy did a study in 2002 and found out that bullseye rash occurs in less than 10% of the time. Mm-hmm. And the reality is, the majority of the people that come down with Lyme disease don't even remember being bit by a tick.
So that's what I've heard from the people that come in that have those diagnoses.
Do you know why? It's because they're not always getting bit by the adult ticks. Most of the time, they're getting bitten by the little nymphs, the real tiny guys about the size of a poppy seed. They bury their head in you.
Do you even feel that when
you
you're bitten
don't even
by
know
those?
that you're getting bit?
Wow.
And so, these people are getting bit by these nymphs, and in the springtime especially, you go out and you come across these areas where the female tick had laid her eggs the previous year, and now that area is just infested with hundreds of these tiny little guys. Mm-hmm. And you don't even know that they're on you. I mean, do you pay attention to little specks of dust that get on you?
Not when you're outside.
Not when you're outside. And you don't even feel them moving around. You don't even feel them when they're biting on you. So the majority of people are getting bit by these little nymphs, and they are getting transmitted. The tick is the primary vector. There's some studies that indicate you can get it from other vectors as well. But the tick, the Lyme, the deer tick being the primary vector. So Lyme disease is let me go back to my notes here. Lyme disease is something that is real insidious, is real hard to find in most people where it began, because for many people is actually a reinfection.
Okay.
Okay. So what is Lyme disease?
It's a neurological assault.
It's a horrible situation. Lyme is caused by the Borrelia spirochete. Now, a spirochete is a class of bacteria that they look just what they sound. They're kind of
Little
spiral in
spirals.
shape, but they're also anaerobic. And so they don't need to have exposure to oxygen to survive. And so you get this little anaerobic spirochete bacteria inside of your body, and the shell of that bacteria is covered with hundreds of different proteins, which means that it can interact with its environment differently in a almost infinite number of ways. They back in the old days, they used to describe syphilis as the great pretender, because syphilis had 36 proteins in its outer sheath, and people would present in any number of different ways. Syphilis they called it the pretender because you never knew if it was syphilis or something else.
Mm-hmm.
Is it syphilis? Is it cholera? Did this guy have a really bad head injury? What's going on? And you wouldn't know until it was way past the point of being able to treat that it was actually syphilis. Well, Lyme disease is similar in that it's got all these different proteins in the outer sheath of that bacteria, and it interacts with its environment differently.
Mm-hmm.
So it can change how it reacts with the immune system of the body. It can change with how it reacts with some of the co-infections and all of these other aspects of the internal microbiome. So, but here's the nasty little rub. Lyme disease is like a congressman. It never gets into trouble by itself. I really enjoy, I take a lot of pleasure in equating microbes to congressmen. I don't know why. I get a kick out of that. I'm sorry. Mo is now on another watch list.
But that's where your parasites come in, correct?
Are we still talking Congress?
We can, yeah, both. It applies for both.
Yes. So there are always co-infections with Lyme disease. There's the three biggies that most practitioners that treat Lyme are aware of, and that's the Epstein-Barr,
Mm-hmm.
or we like to call EBV, just because we're too lazy to say Epstein-Barr. You also have Babesia.
Mm-hmm.
Epstein-Barr is a virus. It's a retrovirus, which makes it really difficult to treat. But it also goes hand in hand with Babesia, which is a protozoa that attacks your red blood cells.
Mm-hmm.
And ironically enough, these guys try to get into the non-vascular tissues as quickly as they can. Why?
They don't need the oxygen.
They don't need the oxygen from the red blood cells, and they can hide from the immune system that's in the blood. Your immune system's in your blood tissues. If they can get out of the blood and hide in the non-vascular tissues, such as the cartilage, the ligaments, the tendons, then there's a free food supply, lots of sugars, glucosamine, hello. Synovial fluid, very rich in sugars, and they eat away at this. And so then you get the joint swelling, and you get the arthritis, and you get all these hip replacements, knee replacements. So you've got the Epstein-Barr, you've got the Babesia, and then you have Bartonella. Good old Bartonella, which is another bacteria, if I'm remembering correctly.
And that's the one that looks almost like stretch marks, but they're not what you think of stretch marks.
It can present that way.
That's how I've seen it, I guess, in person. So
yeah, it can present that way, but these things all go together. So when you get one, you're probably getting the others, at least one or two of the others. or all three, and it depends on what your immune system can keep at bay. But there's an even dirtier little secret that goes with it. 40% of all tick bites are carrying some little rascals called helminths, which are every bit as exciting as they sound. They're little microscopic roundworms. So now, in addition to bacteria, protozoa, and viral co-infections, now you have a worm infection.
Great.
Sounds like the makings of a big salad.
How often do those things actually get detected, though, if somebody goes into their primary?
Very rarely. And I hear this time and again from people. Well, I tried to tell my GP that I think I might have Lyme disease because I have this rash, or could you check me for Lyme disease? And the GP would say, I don't believe in it, and refuse to check for it.
I don't know how you can not believe in it when it's science. And
quite frankly, I don't care if he believes in it or not. Check it.
Yeah.
You're a stinking consultant, for crying out loud.
We're in Wisconsin. My gosh. I mean,
until a practitioner is doing a procedure on you, a chiropractic adjustment, inserting surgical grade needles into your hide for an acupuncture treatment, until we're actually doing a procedure, all any healthcare practitioner is a consultant. When they write the prescriptions, guess what? You don't have to do it. It's recommended. And depending on the quality of your doc, that's up to you to screen and find out if you got a decent one. It's not something you have to do. It's what's recommended. Now, if I've got a patient whom I'm treating and the patient is non-compliant with my treatment protocol, I'm going to fire the patient. I'm going to say, go find somebody else, because you're wasting my time. You're wasting other patients' time. That's fair. And your GP can fire you. It's more fun when you can fire your GP. I've done it. It's a load of fun. But you can fire your GP and find a new one. So a lot of GPs, and even, you mentioned Lyme disease to an endocrinologist, and I don't know about that. And if they do want to get, interested in pursuing something, they might look at an ELISA test. An ELISA test. An ELISA test has been proven already as being bogus for detecting Lyme.
And it's very expensive.
It's very expensive. And that's the CDC recommended you start with an ELISA test. And if the patient has a positive on the ELISA test, then you can do the Western blot after that. But here's the problem. One study suggested that an ELISA test had a 75% false negative.
So what's the point even at that
point? What's the point?
Yeah.
Why waste your time? The Western blot is going to cost around $250. Family Clinic of Natural Medicine in Madison, Wisconsin can do a Western blot. If you're within driving distance and you're concerned, go there. Get a Western blot. It's just a quick blood draw. Within a couple of weeks, you get the results back. And the neat thing is, you can even get cheated on a Western blot. I know, I'm a negative Nelly today.
Well, Lyme is very hard for people to find a good practitioner that can help them. This is one that, your file's that thick. Yep. You went to everybody. You have all these different things.
The word malingerer keeps showing up in your file. This person, it's all in his head. Psychosomatic. He's faking it. And quite frankly, when you start dealing with these people and you see what they've been through, and when you're naturally an advocate for your patients and a protector of your patients, it makes you fighting mad to see how much these dear people have been jerked around, how much they've been told, you're faking it. It's in your head. No.
How often do you actually have that come around that something's in their head with pain or brain fog or, XYZ? I haven't come across anybody yet it's only been in their head.
There's always a reason behind the sensation that someone's feeling.
Mm-hmm.
In Chinese medicine, one of the things that I fell in love with Chinese medicine early on was the people for whom are labeled as problem patients. One of the clinics here in town, the two main clinics, and I'm not going to say which one, the doctors have their untold little joke behind the scenes of a really naughty term for an award that they would nominate troubled patients for. They're laughing at their patients and coming up with this bogus award because the patient is the most irritating and can't figure out what's wrong with him. It's in his head. Chinese medicine says even if you can't find the pathogenesis of the pain, it's presenting that pain might be neurological,
Mm-hmm.
i.e. central nervous system in the brain. It's still there.
Mm-hmm.
You treat it. Which is why Chinese medicine has such this incredible clinical history of taking the cases that allopathic medicine just can't figure out, and we can treat it. I was talking to a lady last week who got the bite. She was fortunate enough to have a rash, the bullseye rash. Went into her doctor and we can do some doxycycline. They did a couple weeks of doxycycline. You should be good. The woman's life started falling apart. Losing hair, losing teeth, pain, brain fog, fatigue, anxiety. All of this starts happening because, they gave doxycycline, but the doxycycline isn't going to kill it all. The doxycycline is designed to get it down to a level where your immune system can keep it in check. So the poor woman went to a chiropractor and to a Chinese doc, and they were testing her using the muscle testing, which in the wrong hands can be pretty worthless. In the right hands, it can be golden. And this poor woman, they gave her a bunch of liver clearing herbs and supplements, probably saved her life, got her down the road. She's still in a chronic Lyme disease pattern, but it's not threatening her life.
How long ago did this process start for her? When was her bite?
If I remember, it was about 4 years ago.
Okay.
So this process can go a long time.
Mm-hmm.
And I see patients all the time for whom they come in, they've had these problems. You start doing the mapping of the pathogenesis of their complaint, and this complaint, and this complaint, and this complaint,
Mm-hmm.
and it all starts going back to around the time when they were 10. Well, where were you living when you were 10? Oh, we were up in the North Woods. Uh-huh. And you like to go outside a lot when you were a kid? Oh, yeah, I had a great childhood. I was always outside. And then I got this really bad bout of flu. And it seems like after I had that really bad bout of flu, I just couldn't, things were different. Didn't have any weird rashes around that time? No. Well, what if I told you a very good candidate for Lyme disease?
They'd be like, really?
They usually look at you like a deer in the headlights because
everybody just thinks the bullseye rash.
Everyone thinks the bullseye rash, or, I've mentioned that to my doctors before, and everyone looked at me like I was nuts. And you're saying that that's a possibility? Yeah. Well, I even took the test. Which test did you do? Well, just the test that they give you. Did you have it here in Janesville? Yeah. Okay, that was probably the ELISA test. And you can't tell anything off the ELISA test.
Mhm.
Now, if you're fortunate enough to get somebody in this town to give you a Western blot, let's say that you passed the ELISA test and you were positive on the ELISA test, then you go and you take the Western blot. The labs here in this town, they don't show you the individual bands. They just say whether it was a positive or negative.
Oh, really? They don't do the printout with.
Wow. That is so irresponsible, because the CDC requirements for needing you to have at least 5 bands testing positive is totally bogus. Do you want to know why? And hopefully by the end of this video, you will understand why I get so irritated when I'm discussing Lyme disease, because you're probably, if you're one of the people that is watching this, you will probably have experienced a lot of these symptoms, and you've been wondering, and everyone's poo-pooing it, and you've been spending tens of thousands of dollars out of pocket just trying to survive, let alone heal. And your life has been brutal. This is why I get angry, because it can be fixed. You don't have to go through all of that. What is the Western blot checking? They take a bunch of blood and they're checking different bands. What are bands? Well,
they put it in like a gel, and then they see how far each of these.
You used to process these, right?
Yeah. Oh God, they sucked. I never could do a good one. All of our equipment was bad. I maybe got 2.
So what did you just hear? What did you just hear from the technician that was in charge of processing them? I never could do a good one. They're difficult to do.
Because you make a gel, and almost like if you're making Jell-O, and it's got all these little cells that stick into it. So when you take this gel out, it's got these pockets, and that's where you take it and you inject the sample into, and then it's in this, the gel's in a liquid, and then from there you're getting the current that's bringing it however far for these bands. Mm-hmm. So you should be able to see, a lighter band here, a dark band at the bottom, however it's supposed to run. And that's where you're going to compare positive or negatives. But
it's not an exact science, is it?
No, just getting the process in general without sticking any sample in.
It's a nightmare.
I hated doing it.
So you've got to have a lab that they're really proficient at this.
Mm-hmm.
The only lab that I'm really comfortable with is IGeneX. The IGeneX Western blot, I'm okay. I'm comfortable with their findings. But they will give you the CDC up or down, thumbs up, thumbs down.
Okay.
So you have to have the readout of what these different bands, were they positive? Were they negative? Were they indeterminate? So what are these bands? These bands are looking for, I just had a mental blank, talk about a Lyme disease fog. They're measuring the body's reaction to the presence of whatever aspect of the spirochete. Some of the bands are looking for the presence of proteins in the outer sheath. Some of these bands are looking for the body's reaction to the flagella of the flagella of the spirochete.
That helps it swim all around the body, and
that help it swim.
Tail.
It swims around. Mm-hmm. Some of these bands are looking for structures, antibodies to structures within the Lyme disease. So you've got these different bands, and the CDC wants to have all these different bands to say it's positive. Wait a minute. Let's think about this for a second. You cannot get an antibody produced unless you had exposure, right?
Mm-hmm.
Ergo, if you have one band that's positive or even indeterminate, Wouldn't it make sense that you had exposure to Lyme disease at some point?
Mm-hmm. You should.
It should.
Because if you never have the exposure, you should never have the antibody, because the body wouldn't know what it is.
And here's where I'm going to get out my little aluminum foil hat and sound like a conspiracy theorist. Why don't they want to acknowledge the fact that the Lyme disease is as big of a problem as it is? And why do we not want to diagnose that many people with it? Because it's hard to treat. It's Western medicine doesn't do a good job of treating it. What do they use? They use doxycycline, maybe erythromycin. They use some antibiotics, but that's not going to kill it. That's going to kill the active flare. But you still have the biofilm. You still have it hiding in different places. And it's just going to continue and continue. So why not call it fibromyalgia? Why not call it chronic fatigue syndrome? Why not say, well, it's just a weird autoimmune reaction? Why not call it kidney failure? Why not just call it chronic heart failure? Why not call it lupus? Why not? You begin to see my point? We've got all these other illnesses. I have 2 patients right now who diagnosed Parkinson's disease. And I said, okay, let's get you tested for Lyme disease. Comes back, they're testing for Lyme disease. Parkinson's can look like Lyme disease. Lyme disease can look like Parkinson's.
Were they even in the right age group for Parkinson's, or were they too young?
In the right age group.
Okay.
But still, one can trigger the other.
Mm-hmm.
Well, Lyme can trigger the Parkinson's. Parkinson's can't trigger Lyme. But you treat the Lyme, and you can get the Parkinson's to slow way down or stop.
That's huge.
That's huge. That's a total game changer.
Mm-hmm.
If you've ever watched somebody go through the Parkinson's decline, it's heartbreaking, and it picks up speed and momentum. If you can break that momentum, you just bought that person another 10, 20 years. Mm-hmm. So Western medicine doesn't do a good job of treating Lyme. They do a terrible job of diagnosing it. You look at some of the numbers, and the indications are that Lyme is an epidemic. You have Lyme, forms of Lyme showing up on every single continent on this planet, except for Antarctica. You don't want Lyme? Go play with penguins. I'm sure you can get other things from the penguins. Bad attitude.
You know what? How
the CDC. I'm sorry. Go ahead.
I was going to say, how recently do you think all this kicked up to that there was more cases of Lyme disease? Because when I was going through my studies for the chiropractic, that was a big topic on Lyme disease. I lived in Dodge County. It wasn't very woodsy up there. It was more farm fields.
Mm-hmm.
I never, that I knew of, had seen any ticks up there. I thought it was more of a north woods thing.
But you saw fibromyalgia.
Mm-hmm.
You saw autoimmune situations.
Definitely.
Maybe, just maybe, these things of Lyme has always been in the epidemic that it was.
It was just named something else.
Maybe we just haven't been catching it. Think of it. The chronic fatigue, fibromyalgia syndrome, just got into the ICD. Was it 9 or 10 codes? I forget which.
I think they were 9 yet.
Okay. That's fairly recent. Prior to that syndrome of fibromyalgia, you couldn't find a doctor that would admit that it's real.
Mm-hmm.
In fact, you still sometimes run into some of the old school docs that say, I don't believe it. Again, I don't care what the doc believes or doesn't believe in. Follow the data. Mm-hmm. Do some forensics. Do some investigation and find out what's going on with your patient. don't rest on your laurels and say, I've never seen it before, I'm not going to see it yet. What, by the way, if your doctor sounds like Walter Brennan, that's probably a red flag. Duke, yeah, you do. The CDC, and remember, by now, if you've watched any of these videos, you know that I'm not true, or I'm not very, sorry, I was reading a comment. Emily, we'll answer your question in just a little bit. I'm not a big fan of CDC findings, okay? But the CDC admits that there were roughly 300,000 people diagnosed with Lyme disease in the U.S. every year. The CDC is admitting about 300,000 people get diagnosed with Lyme's. Yeah, that's 1.5 times the number of women diagnosed with breast cancer every year. I don't see any ribbons for Lyme disease.
Yeah.
That's 6 times the number of people diagnosed with HIV/AIDS. It's a problem. Mm-hmm. Now, has it always been a problem, or is Lyme disease a new disease?
Well, from what we were saying, it just had different names. That people just threw it in the category, and
it was just misdiagnosed.
Mm-hmm.
So, and this is something that fascinates me, because this is where my brain goes. 150 years ago, 200 years ago, when you had the pioneers and the mountain men coming through here, the explorers, the trappers, what did they do? Because they were getting bit by these same bugs. Why weren't they, when you look back in their diaries and their records, why weren't they showing some of the same symptoms of chronic Lyme? Was it just because that they were that tough and weren't reporting it? Well, they did have a different appreciation for pain levels.
They had a whole different lifestyle,
but
too.
They had a whole different lifestyle, and they had a whole different environment that they were existing in. They didn't have the glyphosates. They didn't have the fake phony food. They didn't have the preservatives. They didn't have the dyes. They didn't have the air pollution. They didn't have the water pollution. They didn't have the radioactive isotopes. Mm-hmm. Totally different. The food was totally different. You didn't have the GMO. You didn't have the just the genetic morphing over the last 100 years that we have today.
The lifespans were different too.
The lifespans were different. For heaven's sakes, back in the 1880s, 1890s, doctors were telling people, drink at least 8 ounces of beef tallow a day. That's beef fat. Keeps your joints lubricated. Remember, Walter Brennan is your doctor. Find a new one. Emily asks on the Facebook, or I'm sorry, the YouTube chat. Thank you. Emily asks, is it true you can pass Lyme to others through saliva? It depends on who you talk to. There is some evidence that you can pass Lyme through saliva. There's evidence that you can pass Lyme in vitro to your baby. There's evidence that you can pass Lyme through mosquito bites. And I know that there's going to be some wizard of smart that says, that's not true. That's not true. Look, there's evidence for it. I didn't say that that's always the case. I didn't say that it's a hard and fast rule. I said there's evidence for it. Throw it in the class of cryptozoology if you want. But there's evidence for it that can't be explained. So, you get one person in the family coming and being diagnosed with Lyme disease, and pretty soon everyone in the family is testing for it. How do you explain that? It's some sort of communicable aspect that people can pass just by living in close proximity to one another, whether it's mosquitoes, whether it's saliva, whether it's, getting a scrape and contact that way. Who knows? The point is, it's happening. Wow, we got a question and it wasn't even at the end. Thank you, Emily. By the way, and I should have announced this at the beginning. This is why I'm a lousy host. This is why you're a lousy hostess, because you could have announced this too.
I wasn't sure how long you wanted to wait.
Sitting there looking so innocent. Ha!
You think of cool stuff all the time.
Can you tell I'm excited? We are going to help you with your immune support and function. We are going to do a giveaway. And I should have put this at the beginning of the video. We're going to try to remember to put this at the beginning of our videos.
Okay, but you know what? We know you're invested because at this point you're what, like 45 minutes in?
Yeah, all 4 of you.
So
that's a new record.
Those are real good odds.
If you will like, subscribe, and comment on this video, we will put you in the drawing for a giveaway, and we will be giving away, what are we going to give away, Doc?
Orthomolecular
vitamin D with K2. Why do you want the K2 in there?
Helps you absorb better. Right?
It's not just because you want to, have a flair for the Himalayas. I mean, everyone climbs Everest these days. Any idiot with $100,000 can climb Everest. But K2, oh, that's another thing. Isn't it, K2?
It helps the body use it better, though, isn't it?
Yes, it causes the vitamin D to be absorbed more readily. So we have searched the globe for the best vitamin D that we can find for our patients, and the one that we like is Orthomolecular's vitamin D with K2. It's very high quality. Orthomolecular does a really good job with their supplements, and I don't know if you can see it on the screen or not, but that's what we will be giving away. We will be picking and choosing at the end of the month, figuring out from all of our videos, like, subscribe, comment on any of them, and that will put you in the running. Make sure you tell your friends about this, because somebody's going to get themselves a bottle of Orthomolecular vitamin D. That's a good deal. The other thing I like about Orthomolecular's vitamin D is 1 drop is 1,000 IU.
And you can't taste it.
You can't taste it. It's oil soluble, so it's fat soluble. So you put it under your tongue. You just put a couple drops in there, and woo, and you take it with your meal.
If you wanted to, like, let's say it was in the morning, could you put some in your coffee? Would that work?
You could. Do you know why? Because there's oils in your coffee. It's going to go well.
Just an idea.
And we're in early summer now, but people still don't get outside enough. People still aren't getting enough sunshine. So you still need to be supplementing vitamin D. Most of my patients, I will still say, you should still be doing between 6,000 and 10,000 IU a day. And if you are a plant rat or an office rat, you should probably take more than that. In the wintertime, up here in the Midwest, the frozen tundra, it's not unheard of to put somebody on a very high dose of vitamin D, say 15 to 30,000 IU. Mm-hmm. So you want a very high quality vitamin D, and you want one that's going to go a good distance.
That's orthomolecular.
That's orthomolecular. So we talked about some of the difficulties with diagnosing. Mm-hmm. We talked about some of the frustrations surrounding Lyme disease. Now, I'm going to tell you a little bit about how we diagnose Lyme disease. You ever hear the old walk like a duck, talk like a duck, probably ain't a chicken? Have you heard that? Probably not, because I just added the probably ain't a chicken at the end. I was going to say, the last one. Good, it's not copyrighted. That's one less cease and desist letter to worry about. Number one, you need a clinician that knows their stuff. They can recognize it. We often have a bunch of paperwork at the beginning where we have you go through, and that's to give us a medical history, to give us an idea of what's going on. We look for patterns. I don't have the attention span to do a crossword puzzle. Besides, I'm dyslexic. What's it going to matter? It's going to be weird anyway. But when you're looking at your patient, you're looking for patterns, aren't you?
Mm-hmm.
You're looking for different symptoms that will indicate an underlying pattern of illness.
That's why the paperwork is long and crazy, because it'll be a little bit redundant sometimes, and there's a reason for that.
And that's why we sometimes will say, hey, I know you filled out this packet over here when you started as a new patient, but I've got another 13 pages of questions I need you to answer, and we're going to go through it together. So I just want to go through some of these symptoms that LymeDisease.org talks about as being some pretty classic symptoms for Lyme. Persistent swollen glands.
Mm-hmm.
If you have persistent swollen glands, you probably have some sort of an infection going on. Now, I have patients, I was talking to one last week, swollen gland back here. She says, oh, that's been swollen for the last 20, 30 years.
That's not normal.
Hello. What? Hello, Bueller. Hello. Is that right? Is that the right reference? I should leave culture vultures. So persistent sore throat, fevers, the sore soles of your feet, especially in the morning. Well, that's just
Plantar fasciitis.
That's just, plantar fasciitis. I have a lady who was being treated for plantar fasciitis for a long time, and her feet were getting worse and worse. And she says, it feels like there's cysts on the bottom of my feet. It feels like there's little gravel under there. We test, you start seeing these patterns and these symptoms, and then we do the muscle testing. And the muscle testing tests a very, very strong positive for Lyme disease and Bartonella and some other co-infections. And you say, hey, I think we found the answer.
Mm-hmm.
Then you start treating, and you start going through the appropriate hoops of treatment. And what happens? Things start to get better. But you have to go through the right phases of treatment. You just can't go out and kill a bunch of Lyme.
Yeah, that don't work.
And we'll have to talk about that in another episode. So sore soles of feet, joint pain, joint swelling, and this can be in the fingers, this can be in the toes.
Just like you said, they hide out in that non-vascular tissue.
And what does that usually get diagnosed as? Rheumatoid arthritis.
Yeah. Well, it's hot, it's swollen.
It's hot, it's swollen. Well, then you find out, when you, like me, and you're a little stubborn, and you're not going to take rheumatoid arthritis just as an autoimmune situation, and you say, there's got to be more to this. What's going on? And then you find out that allopathic medicine, when they're successful treating rheumatoid arthritis, what are they treated with? Antibiotic.
Mm-hmm.
Huh? Well, what kind of antibiotic? Erythromycin. Well, you can treat Lyme with erythromycin. Precisely.
Mm-hmm.
Unexplained back pain. Stiffness of joints or back, muscle pain or cramps, obvious muscle weakness. I don't know why. I just have no strength. Twitching on the face or other muscles, not just because you're irritated. If this irritates you that much, you need to find other YouTube content. You get people with the weird twitching in their faces, especially around the eyes. Confusion, difficulty thinking, brain fog, hard to concentrate, hard to absorb things. How many kids out there have been diagnosed with ADHD or ADD, and they're getting poisoned on narcotics?
It's like all the time.
When maybe there's something else going on. Maybe it's pathological. Word search. You're like I was just having earlier. I couldn't remember the word antibodies. Well, I'm treating myself for Lyme disease. It's become an issue, and I have to treat it. Disorientation, getting lost, going to the wrong places. You can see how some geriatric conditions start to overlap into the Lyme world. Well, these dear people have been probably infected for 50, 60, 70 years, and now their immune systems are compromised, and that Lyme starts taking off. And then they get diagnosed with what? Lewy body dementia.
Because it's all brain or nerve tissue that it's attacking. That's why all these different things
Lyme
goes with that.
Lyme and the co-infections can get past that blood-brain barrier. And once it gets past that blood-brain barrier, oh boy, you get severe anxiety, you get dementia, you get all kinds of things happening. So light sensitivity, headache, seizures, psychosis, anxiety, panic attacks, mood swings, floaters, double vision. Well, there's nothing we really can do with floaters. Chinese medicine says floaters is a blood deficiency, liver blood deficiency. How does that translate to Lyme? Well, where there's Lyme disease, where there's Gu syndrome, as we would call it in Chinese medicine, there's a blood deficiency because the bug is taking your blood. Not literally in a Western sense, but in Chinese pathology, that's how it works. Ear pain, buzzing or ringing in the ear or decreased hearing, increased motion sickness, vertigo, spinning, off-balance tippy feeling, lightheadedness, woozy, unavoidable need to sit or lie down, tingling, stabbing, numbness, neuralgia, neuropathies. This is interesting because we get this a lot in the springtime here in the Midwest. Bell's palsy.
Yep.
Dental pain. Why dental pain?
It's still all nerve.
And it's an anaerobic bacteria, so it gets in deep under the gums. Mm-hmm. I was talking to a dentist friend of mine this last winter, and I was telling him about some of my studies. Brilliant guy. Wow. I wish I had the brains he's got in his little finger. And he says, oh, yeah, I noticed a long time ago that every person that has Lyme disease gets a dry socket when I have to pull a tooth. Every time. Why? Because they're anaerobic and they're real deep in the gum tissue. Just then take the tooth out and they just go crazy. And you end up with a Lyme infection there. Menstrual irregularity, weight gain, weight loss, unexplained fatigue and needing to sleep all the time, irritable bladder or bladder dysfunction, unexplained milk production or breast pain, loss of libido, heart palpitations, murmur, valve issues in the heart, head congestion, chest wall or rib pain, heart block on an EKG.
They affect the
night
glands.
sweats.
Yeah, they affect glands. They can get into the muscle tissue.
Hormones.
Any of it.
Lyme carditis occurs, the CDC will say, about 1% of the time. It occurs a lot more than that. How much heart failure out there was misdiagnosed? Our heart was not designed to wear out. You need to have some sort of an external factor affecting it, i.e. infection. If you are struggling with any issues, some weird symptoms, some weird list of symptoms, and everyone's just kind of brushed you off or has taken thousands and thousands of dollars from you and then said, it's why they call it practicing medicine. Trust me, you're not the only one that is ticked off. I see it over and over and over in my patients. And do you know what the average cost for treating Lyme disease is?
Is it like 20 grand or something like that? 100?
Around 100 to 150,000.
That's actually how
out of pocket.
We met through a mutual patient with this disease.
Yes. Yes.
Like, I don't know how things would have went around, but
The Lord
that's the connection
used
here.
the Lord used a mutual Lyme patient we were both treating to try to mitigate her symptoms while she's going through treatment at some other clinic that we will not mention. And they, quite frankly, did a schleppy job. She's seeing another practitioner in Rockford now who's doing a pretty good job. He knows his stuff. And we're starting to see her turn around. I don't care if you're getting results from coming to me or another clinic. I just want you to get better. And if you need somebody to talk to and say, hey, could you at least just check me out? You know, if you're in Chickasha, Oklahoma and can't make the commute, why did I just say Chickasha, Oklahoma?
I can't help you there.
We can do it over the phone. There's questionnaires that we can walk you through and say, you know what? I would strongly recommend investing the money and the time and doing the Western blot. If you're close enough, come in. We'll do the muscle testing. We'll send you up to Madison to the family clinic and have you get a Western blot. We can help you find an answer. And I do have the occasional person say, yeah, well, you see Lyme in everybody. No, I don't, actually. There are some people that I say, wow, that's so cool. You don't have Lyme. Well, how do you know? Well, let's test it. We do the muscle testing and they don't have Lyme. We find out they've got other issues. It's a classic straight Chinese pattern. Wow. I get excited at that. Really an actual spleen Qi deficiency. So believe me, I don't want to see Lyme in all of my patients.
No, it's that
it's
prevalent.
Heartbreaking. And then when you see Lyme in a patient and they say, Mo, I'm having these really weird symptoms, okay, yeah, that's the Lyme, that's the Epstein-Barr. Mo, I'm breaking out all over my arms. I've got these little red sores all over me. That's the Babesia. It's either Babesia or it's mold. Let's check. You check and it's the Babesia. The beauty is to find a competent practitioner, though, that has the ability to check these things, and two, can show you what you can do to alleviate these symptoms. It's so important, because what's going to happen? Your quality of life is already down here. You were up here, you got infected. Now your quality of life is down here. Your quality of life is going to drop further. You're going to develop more allergies. You're going to develop more, quote, autoimmune issues. We're going to put you on more immune suppressant drugs. Oh, great. That's just what you need.
Drive you further down.
Drive you further down. You need somebody that's going to work to not just kill things, but repair you. And that's where we come in. And you don't have to use us if you don't want to. There's other competent practitioners around. We can network and find you somebody. If you haven't guessed, one of the reasons that we brought Dr. Noel in is because she's a kindred spirit. We're very passionate about our patients. We're very protective of our patients. We work very hard to find answers for our patients. Because we know, we've seen it in our own families, we've seen it in other patients. We know how devastating this stuff is. And I think we're going to have to do another show on Lyme disease to talk about more diagnosis, talk about treatment.
It's a big topic. It's a really big topic.
It's a huge topic.
Because you already said how many aspects.
And we haven't even touched on the co-infections.
No.
So I know we've got our map for programming, our programming map of what shows we're going to be doing. And next week, we're supposed to be talking about structural medicine, We may talk structural medicine. We may say, let's do another Lyme.
I think we should just keep going with the Lyme.
Then let's just keep going with the
And
Lyme.
if you guys have questions, throw them out there because it's going to keep the conversation going with this. 'Cause
Yes.
I know you got questions.
Yes. If you've got questions about Lyme, for goodness sakes, ask. We had a question here come in on Facebook. Okay, so $65 to do a physical exam and look at potential for Lyme. Yeah, with me, it's to do an herbal consult. I break it up into half-hour increments, and it's $65 per half hour. We can usually tell within a half hour if Lyme is an issue and develop a protocol. We can do a lot in a half hour. Goes fast, but we can do a lot in a half hour. If you don't want to do the acupuncture, that's what we would do, is we would do an herbal functional consult. Most of the time, though, I'm going to take advantage of the fact that for $50, I can do a new patient visit with acupuncture. I can do all of the new patient information, and I can give you an acupuncture treatment to try to affect some of the acute issues.
Mm-hmm.
And there's usually enough time to check for Lyme.
Why not do the whole thing?
Why not do the whole thing? And what I'm also finding is for NAT new patients, I would rather just check you for Lyme and co-infections, because if we go through the process of NAT without addressing the Lyme, it's going to take forever and be super expensive. But if we can address the Lyme and then 3-4 months into the protocol, start working on these allergies, you start clearing the allergies, bing, bing, bing. And in Wisconsin, where Lyme is so prevalent, that becomes a major issue. So I hope that answers your question, Cindy. Okay, so once again, you have wasted a perfectly good hour. I love that. I hope that it wasn't a waste. I hope you learned something. I hope you got some hope. You're not alone. You're not nuts. There's other people that are suffering just like you are. Some people suffering a lot worse even. And there's answers and there's hope. You don't have to go living like this. So give us a call. Call our clinic, 608-314-8791. Talk to Carrie. Get on our schedules. We can help you. Until next week, shalom. And we'll be hitting the Lyme topic again next week. So shalom and have a wonderful week, guys.
That's fun.
We got to figure out how to get that transferred over.